Now, I don't want to get too much into the techniques of it, but photoreceptors are the little cells within the structure of the retina that actually convert light into an electrical signal. There is approximately 125 million photoreceptors out there. They are not evenly dispersed. There are more jammed into that macular region, which is why you have that sight sensitivity. But it's a bit like a mosaic is made up of individual dots. But if you can imagine that maybe somewhere in the centre, instead of having pieces of tile that big, they had them the size of a grain of sand. And so there's a small portion right in the centre which is much more able to have much more detail. That's what the macula is. If that makes sense. Yes. Now, that is pretty ugly. What are they? What are all those? Now, you don't have to be a rocket scientist to know that that's Houston, we've got a problem. That is a build-up of fatty, waxy waste products. They call those build-ups, they're called bruising. And it's kind of like, I've heard one doctor describe it as chronic constipation. So those little photoreceptors, they produce a lot of waste products. So the macula has a particular problem. There's more of them, so it's producing much more waste products than the rest of the retina. But also the area that produces the highest concentration of waste products also has the least amount of blood supply to it, because it hasn't got that surface blood supply. So all of its waste products have to go, exit through a little barrier membrane, like a weed cloth, into the blood vessels. Now if you get these build-up of waste products underneath the retina layer, they can no longer get the direct blood supply. In fact, and the waste products get away efficiently. So in a sort of spiral down, if you imagine, the more waste products build up, the harder it is for additional waste products to get away. And it means that there's a separation from the cells and the blood supply, and they start to wither and die. Now that is called dry macular degeneration. So it's a slow crumbling of dry macular degeneration. It's a slow blunting of the vision over years. And I say it's like, you ever seen an old mirror which has been perished, a bit patchy? It's kind of like that. So you get this sort of patchy wearing away. It will rarely cause complete vision loss. Most people with dry macular degeneration, for example, can still drive a car. There is a number of people whom that patchiness is so complete, and I would suggest that the last diagram I showed you was one I sort of feed. That loss of sharpness will coalesce and congeal into one block where you don't see anything at all. And that's called geographic atrophy. So you get this patch, this area of loss of central vision. That's the exception. Most people don't go blind with this. 90% of the disease is this dry forming. You can see what's happened to this poor fellow. He's still there, he's recognisable, but he's just not as good as he was. 10% converts to this wet form. What's dry? Well, I told you what's wet. Well, wet is this. Again, you don't have to be a rocket scientist to know that that stuff is not normal. There's a big spread blotch in there. And that looks a bit horrible as well. Now, what that is, remember I talked about a membrane like weed cloth that separates the cells from the blood vessels? The dying cells, the retinal cells that are dying, release a chemical. Help them dying. Help me. If there's a little crack in that weed cloth, blood vessels get stimulated to grow through. Trouble is they're not very good. They're destructive. They break, they bleed, they ooze fluid, and you can see that is not. So it goes underneath the retina. First thing you'll see is that the retina will start to get lumpy and uneven, so your eyesight gets distorted. When it breaks and bleeds, it causes a relatively rapid loss of central vision. The dry form can take years, and you may never lose it entirely. This form, if you get what they call a neovascular membrane, which is a sheet of new blood vessels growing out, like weeds invading your garden, within weeks or months, you'll have a complete loss. 100%, if you don't treat it. What you can do is laser that. What you used to do is laser that to try and contain it. It wouldn't actually, 50% of the time it just flat out didn't work. But what you would do is something that would take weeks or months. It burns itself out. It doesn't go across and take the whole lot, but it takes out a blot over weeks or months. The doctor were in the position that, well, if you laser it now, I can contain it to an area maybe that big, but it'll be like that. And all you can remember is that I could see that day and next day I couldn't, and the doctor was the last one to touch it. And half the time it kept going anyway. So the doctors, it was a terrible position for the doctors to be in. And you can see over time, when everything settles down, that's like a scar in the centre. There's no nice healthy orangey colour to it, it's just, there's no function in that, and that would be a corresponding loss. It's not really a black blot, even though we describe it as black, just nothing's there. Nothing's there. Some people do actually literally see a black blot early in the piece. You can see this poor fellow, he's really not looking so chipper, is he? And that's the blot, which can be very big. Some people in the early stages is like eventually just proceeds to an absence of something. Can't I just get stronger glasses? That's old lament? No, because it's not a problem of focus, it's damage to the film. So stronger glasses won't help. Now, the dry form, the one that happens over years and doesn't usually blind you, there's nothing we can do for that as such. Doesn't mean it's the worst form to have. The wet form, there is something we can do now, but it doesn't mean it's the best form to have. But we can treat it now. So there are injections you give inside the eye, which is the gruesome bit. We're used to it, but it doesn't thrill most people. It switches off that chemical that stimulates the blood vessels. The trouble is, you need several doses. The current thinking is 3 monthly injections over at least 2 years. Hopefully you can stop that after that. But some people, we've had a few. Dr. Jeffries in our clinic's been doing it for about 4 or 5 years now. There's a couple of patients just every 3 months, every time we try and stop. Now with this particular treatment, if you think of a standard vision chart, if you come in and have wet macular degeneration diagnosed, remember, without treatment, 100% of the time, you lose vision, you wouldn't even see anything on the chart. With the old style hot laser treatment that we used to use, 100% of people would have a big hole in the centre of their eyesight. Maybe that would stop it from getting very large. Now with these treatments, 95% lose no more than 1, 2, 3 lines from when we first present. Actually within that 95%, 1/3 of all patients actually improve 1, 2, 3 lines. 95%. 1 in 20 still gets away. The trouble with all this though is even if you get the wet macular degeneration to settle down, you've still got the dry form. You have to have the dry form. So they're the latest treatments. We're talking about risk factors. Somebody said before, is it hereditary? 1 in 7 people are affected over 50, 1 in 3 over the age of 75. If you get to 80, you have got a 200 times greater relative odds risk of getting it than if you are. If you look at those risk factors, some of those you can help. If you're a smoker, quit. Blood pressure, heart disease, see your GP, high cholesterol, excessive sun exposure. You know, I say we have white collar skin, we've got black collar country. And we're really not right. So things that you can do. Aside from keeping yourself healthy, antioxidants, there's been a lot of information about antioxidants. I think it is much better to get these things from your diet than to get them from a supplement. You want lots of colour. You want vibrant green leafy vegetables. You want coloured fruit and vegetables, and the darker and more intense the colour, the better. So blueberries, blackberries, if you've heard of them, bilberries, strawberries, carrots are good for your eyes. Omega-3 fish, one or more times a week, and lower your fat intake. Now I think if a GP saw me give this lecture, he or she would not be too upset with me. That's what I'm saying. It's common sense. You know. If you get all of your antioxidants and your zeaxanthin and your lutein from this diet, you're pretty healthy, aren't you? But it's good, you know, it'll help everything.